Welcome back to Living with Sickle Cell with '05. I'm your host, '05. And today we have, what's your name? I'm sorry.
Ashley Griffith.
Okay. And where are you from?
I'm from Miami, Florida.
Miami, Florida. Okay. You born and raised there?
I'm originally born in New York, but I'm a transplant down here to Miami, so I consider Miami home.
Okay then. Okay. Okay. So would you ever go back to New York or are you gonna stay in Miami or?
I think, especially now at this time of the year, I think I'm enjoying our weather here in Miami. So New York
Yeah.
is a little too cold majority of the year, so I think I'm pretty much a Miami girl now.
There ain't nothing wrong with that. There's nothing wrong with that. Okay then. Okay, so if you don't mind, just give us an introduction. How we met and well on online, but introduction of how you take care of sickle cell patients or whatever you want the world to know.
Cool. Again, my name's Ashley. I am a clinical pharmacist. I specialize in emergency medicine and integrative medicine. Of course, living in Miami, we have a large demographic of people from the Caribbean, Latin America, and Central America. So, treating patients with sickle cell anemia is a part of our natural patient population. It's not a rare disease that we're used to seeing. It's something that at least once a week, no, in the 7 day period, I would say at least three days out of my 7 days on in the emergency room, I'm taking care of patients with sickle cell disease. Um, sorry.
Wow. No, that's a lot.
So in the week, we have one of the great things that I love about my facility is that we have sickle cell disease protocols that we implement. Our hospital actually has a sickle cell disease outpatient center with Memorial Healthcare System. So our community really embraces the management of sickle cell disease in our community. In addition to emergency medicine, I focus on integrative medicine as well. And that's more of a community-based management with sickle cell disease, where we assist with just lifestyle management, drug and disease state management, and helping patients find appropriate vitamins and supplements specifically for their bodies, and helping with medication compliance, right? Especially with our young patients that are transitioning into adulthood, where their parents mainly took care of them as kids. And now that they're doing that transition, going into college, just helping them be an advocate for their own health as well, and just letting them know that how they can utilize their pharmacist.
Right. Okay. Wow. Okay. Is there a specific medicine that you would recommend for someone to, you know, take since they're transitioning into their adulthood, like hydroxyurea or folic acid or?
Yeah, I love hydroxyurea, folic acid. One of the major things that we always focus on is making sure that vitamin D levels are optimal, right? When
Mhm.
patients, especially and with they're living with sickle cell anemia, studies are showing us that making sure that your vitamin D levels are at optimal levels is a great way of helping the body, the red blood cells work optimally in the body. What's happening, of course, as you are aware with patients with sickle cell disease, your red blood cells are reproducing at such a faster rate. The average person, their red blood cells take 120 days to regenerate. Because your red blood cells are regenerating at such a faster rate, right? You need to make sure that you're having the appropriate vitamins and supplements so for the red blood cells to produce and absorb. Your red blood cells are producing and dying off at such a more rapid rate, which is than someone that is a non that it's someone that is a non sickle cell patient. So we want to
God.
that focus on that when we're not in crisis. Focus on that, like for just disease state management, and then yeah.
Okay. Is there okay? Wow, I did not know that. What about vitamins? What vitamins would you recommend? Like, because I'm trying to get on the vitamin straight, but I don't know. I'm thinking about taking a one a day men's, but I can do better.
It's a great place to start with a multivitamin. I also recommend vitamin D, like I said before.
Yeah.
Um, B vitamins. We do know that folic acid helps with red blood cell production. So because your red blood cells are being reproduced at a faster rate and also dying off at a faster rate, we want to make sure that you're getting the appropriate vitamins in your body for red blood cell production. So vitamin B, B vitamins, complex vitamin D. Um,
Mm.
Zinc is another great supplement for patients that are living with sickle cell disease. Because as you know, are you on antibiotics chronically or no?
No,
Okay.
no.
So some patients, especially with children, for the first 5 years of their life with sickle cell disease, they're on antibiotics on a daily basis to prevent something called neutropenia, which is a decrease in white blood cells. So we
Mm.
know that zinc helps with the immune system. White blood cells are for the immune system. So zinc shows us that it has a great benefit to the immune system. So zinc is another great vitamin, and of course, glutamate.
Glutamate.
Yeah, glutamate is another protein builder that also assists with red blood cell production. So those are my four vitamin recommendations for anyone that it's good for anyone. Anyone should be
Yeah.
taking these,
Yeah.
but especially for someone that's living with sickle cell disease.
Are any of those like a great help with the immune system with someone with sickle cell?
Zinc. Zinc is a
Zinc.
great boost in the immune system. It helps the immune system significantly because it works with the white blood cells. And the white blood cells, those are our soldiers against viruses and infections.
Mm. Okay. Wow. Okay. Well, okay. So in the hospital, when you work in the hospital, what kind of medicine do y'all usually give out to your sickle cell patients that's going through a crisis?
So that's going through a crisis. So one of the first things that you always want to address with our patients is that what a crisis could be a pain crisis. It could also be a crisis that could be resulting in a heart problem, a kidney problem, a lung problem. So one of the
Mm.
first things that you want to assess is that, of course, within the first hour that our patients come in, we get a line in to get pain medication because the first sign is pain. The first sign is pain, so we can actually do the investigation. So we always start traditionally with, if we're unable to get a line, we use intranasal fentanyl, uh, morphine, um, Dilaudid. Those are our pain medications that are on our protocol that we use for many of our patients. Once we're able to get pain tolerable, I would never use the word under control. I would say
Mm.
tolerable.
Mm.
We're able to start getting labs and start to investigate why the patient is experiencing the crisis, right? You're never going to, unfortunately, with crisis, you can't, you try to get it under control. Sometimes you're able to, sometimes you're not.
Right. Well, how do you feel about the Benadryl giving out? A lot of nurses and a lot of doctors have different, mixed emotions about that. What's your opinion?
So Benadryl, again, what we always say to our patients and we always try to get across to our nurses is that sure, we've read the books and we've gone to school to study medications. You've been living with the disease your entire life,
Mhm.
right? You know how it feels and how it works when you're receiving the medications. So we're taught in school that when Benadryl is added, it heightens the effect of the medication, right?
Mhm.
Where with patients, they tell you, no, it reduces the itching. So we
Mhm.
do know that we have like the antihistamine effects that are Benadryl. If I break out in hives or anything that we eat that has an allergic reaction, we use the Benadryl. So a lot of our patients, we especially we are fortunate that we're allowed to see many sickle cell patients that we're on an understanding that the Benadryl is needed to assist with the itching. But for a naive nurse or a naive doctor that is not used to treating patients with sickle cell disease, they may think that you're using the Benadryl to increase the efficacy of the pain medication, unfortunately, when we know that it's used for itching.
Yes, yes,
It's stigma.
yes. That
The stigma of a person of color requesting pain medication is what we're ultimately dealing with.
yes, yeah, you're 100% correct. Yeah. It's like getting pulling teeth even if you ask for Benadryl, they gonna look at you like you're not in pain. You just want, So it's a lot. It's a lot. But I understand that because some people, unfortunately, they do use it for that. I'm not gonna say they don't, but there's a lot of people that do.
Yeah.
But it's okay. Itching.
We have
Does
to
it?
protect
Yeah,
ourselves. It's not okay. And it's not okay that when someone is sitting there in pain to
yeah,
judge that moment when they are in pain, you know,
yeah, yeah.
something that
So what
needs
made
to,
you get into the nursing life?
I'm sorry.
What made you get into the nursing life and the pharmacist life?
Oh, that's a great question. So, I've always wanted to be a chemist, right? I loved chemistry. My favorite, I don't know how, I think I'm dating myself now. You're going to be able to know my age. My favorite show as a kid was The Magic School Bus.
What? Me too. Yeah. Okay.
I love the Magic School Bus and the science teacher and just learning about like the planets and learning
Mhm.
about all the sound. Two things that were my favorite was when she did the sound episode and two, the human body.
Yes. Yeah.
What I loved about the human body was going through the systems and seeing the heart and the kidneys. And just,
Mhm.
I think that it tied in pharmacy, tied in my love for the human body and chemistry and just learning how chemicals and medications and plants can affect how the body works. Right. And
Yeah.
I don't regret any moment of becoming a pharmacist. Every day I learn something new. I will
Mhm.
never tell you that I know it all. And any healthcare practitioner that tells you that, run away fast.
All
So
right.
I do love the chemistry. That's what made me get into pharmacy. I love chemistry, and I've always loved learning about the human body, and like just being able to bridge that together is something that I continue to enjoy in my career.
Okay. Well, okay. Yeah. Okay. Magic School Bus. Yes, that's a classic right there. Pretty much classic. How do you balance the schedule? Does it get overwhelming or?
Yeah, I definitely will say that it gets overwhelming, especially after coming out of the pandemic.
Mhm.
Um, I think that the pandemic really showed us the effect that an impaired immune system. Many people had their own opinions about COVID, right? As you know, we saw it in the news. Everybody had their own opinions. But what was not addressed was our large population of people that are living with chronic disease states and how it affects them. Um,
Mhm.
Access to medications, making sure that we're keeping them safe with an infection because their body is already under stress managing a disease state, and then you tie in something like COVID-19, which was a pandemic. It just added more stress to the situation and being able to provide adequate care um, for families and patients of that nature. Um, Emergency medicine is it's an emergency. Sometimes an emergency can be falling off of a ladder or accidentally having a laceration on your arm, and it could also be someone coming in complete cardiac arrest. Could be someone coming in a drug overdose. So depending on your presentation, it can be extremely overwhelming. But
Got it. So the emergency medicine, like the pharmacist, is I'm trying to wrap my brain around exactly everything that you do. So if you don't mind, could you explain it a little?
yeah, of course.
Yeah.
So, for example, we have a patient that comes in with sickle cell disease. One of the first things that I do as a pharmacist is pull up the medication profile for the patient. I look at previous hospital admissions just to make sure that we get the correct protocol, right? So a lot of times you have a different doctor or a different nurse. As the pharmacist, I have access to many of your records and you've had filled with pain medication or whatever medication you've been taking. So I'm able to utilize that to initiate your care as quickly as possible in the first hour. That's why they love to have us in the emergency room because we're able to address, you're saying, hey, Nick, I'm so sorry that you're not feeling well today. Let me make sure that we get everything on file for you. Did you take this today? Did you take that today? No, no, no.
Okay.
Okay, no problem. Let me get that on board. Um, if you're coming in, if you have a team member or a physician that may be a little bit naive to understanding the disease state, I'll give you an example. Let me tell you this, what happened to me this week. Do
Okay.
you know what prism is?
Uh, yeah, like you extend your, yeah.
Okay. So I had a patient that had a pleurism this week. And he
Wow.
was a he was someone that was living with sickle cell disease. And
Mm,
it's very common in men that live with sickle cell disease, right?
right.
What also happened was that his blood pressure was completely out of control, right? Which he had extremely high blood pressure in addition to having the pleurism.
Mm,
One of the things that we did was understanding like what would be the emergency? Is it the pleurism or is it um, his high
blood.
blood pressure? And the medication that's used for pleurism is phenylephrine, which will continue to increase his blood pressure. So
Mm,
and that also led him to falling into crisis. So when you a lot of times many patients are coming in and presenting with one issue, but it's a very complicated, there are multiple issues that are happening at that time with a patient that's living with sickle cell disease. So you want to make sure that you have your pharmacist on board, your doctor on board, your nurse on board that are able to address that issue as quickly as possible, because the last thing that you want your patient to do is fall into pain or
right.
fall into crisis because of
Yeah,
being under such severe stress.
right. So what was the main, what did y'all take care of first? His pre-prison thing or the blood pressure?
We took care of the blood pressure and the pyroprism at the same time. So what
Oh.
we was give him blood pressure medication, help bring down his blood pressure, because again, we're giving you a medication called phenylephrine, and which can just tighten up the vesicle. It relaxes the vesicles that are in the penis, but it can tighten the blood vessels that are leading to the heart. So this patient, it's weird. It's interesting, right? So
Yeah.
it relaxes one area of the body, but constricts another area of the body, right?
Okay.
We want to make sure that we're not affecting the heart. So one of the things that we stepped in to do was make sure that we're providing adequate blood pressure medication to lower the blood pressure while we treat the pleurism, because they're both an emergency at the same time.
Mm-hmm. So, so I never been through that. I've never in my life been through that. I'm about to turn 28 in like 4 days. I never in my life, and people think that's so weird.
Yeah.
How is it? Like, do you have to have a certain type of genotype of a sickle cell to experience the not experience, but deal with the priapism, or is it something
Yeah,
you take? Or,
have a certain genotype. It's very common in men that are living with sickle cell disease, just because remember your blood cells are very are sticky and sickled, right? So it gets stuck. So what is happening to that patient? And as you know, when a man has an erection, there's an extreme amount of blood flow. There's an
mm,
extreme that's how you're able to have an erection is that there is blood flow pumping to an organ in your body. And when that gets stuck, just like it does in it, it can get stuck and trapped just like any other part of your body.
wow. Okay. So should someone if okay, a lot of questions, sorry. So is there anything that you can take to not have that happen, or is it just out of the blue?
It happens out of the blue. And if it does happen, if any man notices an erection over an hour to two, especially to 4 hours, you are supposed to go to an emergency room immediately. That is
Yeah.
considered a medical emergency.
Yeah. Do you have
Um,
to stick a needle?
yes. Not You stick a needle in the vein of the shaft of the penis, and one or two shots of phenylephrine, and it automatically will relax the organ.
Okay. Okay. And do you have to get admitted or can you go home?
Go home right after that. Any emergency room physician can take care of it. Sometimes a urologist may come in to assist, but it's not something that requires admission. Now, what can require admission is if the stress of the situation causes the patient to go into crisis.
Crisis. Okay. What about women? Their reproductive health. Do you know a lot about that or?
Yeah, so I wouldn't say a lot. I know about emergency medicine
Yeah.
when it comes
Yeah.
to not a gynecologist. I'm a pharmacist.
Yeah.
When it comes to like women's health, with do know that with menstrual cycles, cramping, you fibroids, just blood loss in general, just adds more stress to the body for a patient that is living with sickle cell disease. We manage it mainly symptoms wise, medication based. When it comes to, you know, that's where we decide whether or not iron is necessary, especially for a female patient that might be losing too much blood during their menstrual cycle. They may be suffering with anemia. They may need to come in for blood transfusions,
Right.
because and we do notice that particularly with women, more when it's around their menstrual cycle, the body is losing blood and their body is already, remember, what was the one thing that is happening with sickle cell patients? Their red blood cells are reproducing at a faster rate than the person that is non-sickle cell disease. So this is where anemia often comes in, is that the red blood cells are often very low.
Right. Okay. Okay. So with your pharmacist job, like administering the right medication, is that a hard thing to like is it tough to give somebody the do you have the final say so to prescribing the right medication to the people that come in, or do you have to go to somebody else and they say yes, that's the right medicine, or it's just all on you?
Yeah. So when it comes to prescribing, the one, again, many patients that come in that are adults that are living with sickle cell disease, they're very comfortable with telling you their medication regimen, right? And
Mhm.
at the end of the day, we tell the patients educate us on what their treatment process is. You know, that we want the patient to be just as a part of their treatment as we are, right? We're just here to make you feel better so you can get back to your life, right? So many patients come in. We, like I said, if we find out what their treatments are, how do you usually manage yourself through this process? Get your pain medications on board, communicate. It's a team effort between the doctors, the nurses, and the pharmacists to initially get our patients under control so we can actually investigate why the crisis is happening. Why the crisis is happening. If it's a pain crisis, then we'll treat that. Is it because of an infection? Then we need to treat that. Is it because the patient may be having a stroke? Then we need to treat that, right? So one of the major things that we try to do is understand why the patient is presenting into the emergency room and why you are experiencing crisis.
Yeah. It's a lot of sickle cell patients dealing with a lot of mental health. I've learned recently by doing this podcast. Have you had any patients that, talk to you about their mental health, what's going on, or
You know, in emergency medicine, we don't often get the opportunity to sit down and speak about mental health, unfortunately.
mm,
Because at the time that most of our patients don't really want to talk to us at the time, they're not feeling well and they just want to feel relief, and they want to feel relief, and they're in pain, and when you're in pain and agony, you're not really in a space to really want to talk.
that's
um,
true.
yeah, we can see, you can see the patients that maybe are struggling with their mental health, are not in a position don't have adequate support systems. You're able to see that. But at that time, the priority is their pain management and getting them out of crisis. So unfortunately, in the emergency room, we don't have the time. We don't be, we, it's not, we don't have it's not the space to address the
So,
long-term mental health effects, which is why we
mm,
do have the mental health, which is why we do have a sickle cell center with our hospital, just to be able to navigate those resources.
mm,
Often you'll be in a clinic with patients, a variety of patients that are living with sickle cell disease. Because so that in itself, I would hope is comforting to the patient, like, okay, so you understand the fact that you, just like you have a cancer center, just like you have a sickle cell center that is dedicated to their sickle cell patient population, um,
mm,
be able to provide you with the resources, hopefully the resources to get the mental health support that you need.
right. Right, yeah. On your Instagram page, I love your Instagram. Like
Oh,
you
yes, you
post. Thank you. What made you, get so involved with the sickle cell part? Do you know, or you just
So,
went along?
so again, I grew up in South Florida. I'm from New York, which is again, I grew up in Brooklyn, New York. Also living in South Florida. My family is from Grenada. And do you know who Walter Clement Noel is? Have you
No,
read
but I
about?
want to know.
Huh?
No, but I want to know.
Okay. So he, if you get a chance, you can like Google this gentleman. He was the first person in the United States uh, that they discovered sickle cell, and this was in like the 1920s, right? And he was from Grenada and was at in Chicago as a he was in dental school as in dental school at the time. And one of the physicians, when they didn't realize why he was sick, his pain, just things of that nature, when they sampled his red blood cells, they ended up finding out that these are of a different shape. Like, how come the red, when they put it under a microscope? I'm going to send you the link about it. It's really interesting.
Yeah.
And I that's what he was the first person in the United States to be that sickle cell disease was recognized in. He wasn't the first person to have sickle cell disease, but he was the first person that they recognized it in,
Yeah.
right? And like I said, my family, this gentleman was of Grenadian descent. He's an extended family member of mine. So it's something that we have always known about in our family. We've always talked about it. We understand, and living in the Caribbean, we have a large patient population that are living with sickle cell disease because we have such a large community of people of African descent, West African descent, particularly.
Yeah.
When I was growing up. So it's always just been a part of my life. Sickle cell disease is not something that I learned about in school. It's something that I learned about through my family lineage. It's something that my childhood friends, I had a very, may she rest in peace, I had a childhood friend that died of complications of sickle cell disease. So it is not something that I grew up learning more about the social aspects and the mental health aspect and the community aspect. And it wasn't until that I went to pharmacy school that I started to learn more about the medical aspect. I never understood, said, oh, why are we always visiting her in the hospital? How come today she can't go to the pool? Oh, she's not, little things like that at like 7 and 8 years old that you're not understanding why your friend can't participate. And
Yeah.
you're learning about this disease state and you're like, okay. And then when I got to pharmacy school, I'm like, oh my God, is this what she was living with? Like,
Yeah.
I can't even believe that she was able to borderline be a normal person with her body going through all this trauma, you know? So
Yeah.
I had the opportunity to learn more about the social aspects of mental health and the community and the family aspect and how important is the support at an early age. And now more medical aspect of it.
Yeah.
So
Wow. That's oh, wow. Okay.
I
So you don't have it.
have the sickle cell trait.
Trait. Okay. Okay. And that's AHS, right? Or is that was AHS? Okay. So you don't, have any crises ever, or you just have a little pain here and there, or
No, I don't. I've never experienced any symptoms from
mm,
having the sickle cell trait. This was something that like was told to me by my mom when I was about 9 years old or 10 years old.
mm,
And then started to learn more about, and believe it or not, like 1 in 13 um, people of African descent in the United States are living with the sickle cell trait.
wow.
one 1 in 13. And sickle cell disease is the most common blood disorder in the United States. Over 100,000 people are living with this disease state in the United States, but it's extremely underfunded compared to cystic fibrosis. Just
Yeah.
dollar for dollar. 30,000 Americans are living with cystic fibrosis, while 100,000 Americans are living with sickle cell disease, but yet it's funded 3 times more, right? So it's so important. I love your podcast. I think that you're doing such a great job just bringing awareness.
Thank
One in 15, we know more than 13 Black people.
you.
We like 20, like, and
Yeah,
so it's not, the way sickle cell disease is approached as like a rare disease. We need to scratch that. It's not
yeah,
rare. One in 13 people of African descent are living with the sickle cell trait. And then
yeah,
yeah, so that's significant.
yeah. Why do you think that is? Do you want to touch on that, or do you think we should just leave it alone? Or
About why we,
why is it like underfunded and all that?
yeah, like racism, like
Okay, I didn't, okay.
it, but it's not seen as it's underfunded, just because when it comes to another aspect of the Black health crisis. We have one in maternity. We have one, um, we we have it. I'm so sorry. We have it in maternity, and we have it in mental health. We have it with breast cancer, and unfortunately, this is another disease state that plagues us in the community, that is not often that's underfunded and not addressed. That's why what you're doing is amazing. What you're doing is amazing. Creating a podcast, bringing on different people to talk about it, speaking about your own experience. I mean, you're living with this disease. You're living
Yeah.
with it, and you're using your platform to be able um, to educate us and giving me an opportunity to talk. Like, thank you so much.
No, thank you. Thank you. You've been doing this way before me. I'm trying to catch up to you. But yeah, I didn't know if I wanted, I mean, forget it. We got to be real about it. So it is what it is, but that's ridiculous. It shouldn't be
Yeah.
underfunded. Wow. If you met a 12-year-old little girl and she came up to you asking for advice, like what advice would you give her about sickle cell? She has sickle cell. She didn't, have any family members. She came to you, what advice would you give her?
I would tell her to always make sure that she's taking care of her body, listening to her body, advocating for her health, right? As when you're a kid, she's 12 years old, so she's rolling over, getting
Right.
ready into adulthood. So, when you're 8 and 9 years old, you're cute. Everybody's listening to you at the hospital. You're at the children's hospital. They're
Right.
bringing you special ice cream to make you feel,
Right.
and then you're about to be 6 years away from being 18 years old and thrown into the adult care system,
Yeah.
where
Yes.
now you're being perceived. I wouldn't, of course, at 12, I wouldn't tell her like now you're being perceived as an addict, or are you going to be are you going to be judged? But just at 12 years old, always listen to your body. Like, how do you feel today? Like, really, how do you feel today? Am I getting the rest that I need? Am I getting the nutrition that I need? Am I getting the proper hydration? Right? Because the best way we cannot prevent sickle cell crisis. What we can do is work on our management when you're in crisis, you're in crisis. It's not something that we try to prevent it as much as possible, but when it happens, we have the management for it. Um, are you taking care of your mind? Are you
Yeah.
taking care of your mental health? At 12, how would you do that? What do you like to do? Do you like to draw?
Yeah.
Do you like to dance? Do you like to sing? Do you like to plant, be in nature? Do you like pets? So just at 12 years old, like acknowledging the things that make you feel good and make you feel at peace, and making sure that that is being addressed, as important as listening to your body and getting the nutrition, learning how to cook healthy foods for yourself
Yeah.
and things that you like. That's
Yeah.
what I tell a 12-year-old girl.
Okay. That's a perfect answer. Okay. That was a very good answer. Okay, I have one more question for you. How has sickle cell affected your life in a positive way?
Sickle cell has affected my life in a positive way in that, again, I'm living with sickle cell. I have the sickle cell trait. I
Trey, yeah,
don't have children yet, so it's something that, my husband and I, that we have to talk about. It's affected me positively in that I've gotten an opportunity to one learn about what how it's affected me positively is that I've gotten to understand how this disease affects the planet and globally. One of the things that we want people to understand is that this is not a Black disease. It's more
yeah,
prominent to people of West African descent. However, you have it in parts of Europe, you have it in South Asia, you have it in the Middle East. And so understanding that it is a global issue and just understanding just how we're interconnected and
yeah,
learning about how amazing, again, I love the body, learning about how amazing the body is, that this was a defense mechanism that the body created against malaria.
there,
Like,
yeah,
amazing is that the
yeah,
body learned to adapt itself to try to create this barrier. So it's shown me the beauty of the body, right? It's shown me the power of community and how we have to continue to educate ourselves. Like, we have to educate ourselves, practitioners of color that are of these demographics. We have to educate ourselves on how we're able to treat our patient population and advocate for research and funding and using our knowledge to really advocate for people that may not have the resources for it, you know. So that's it's a I do when I have students. I had a resident this past few months, and
mm,
she's from Texas, a white woman from Texas. And she was working at our hospital, and she said, "I thought sickle cell was a rare disease. Oh my God, how come we have so many patients here that have sickle cell disease?" She's like, I'm seeing like 2 to 3 patients a week. And I had to tell her, I was like, one, you're living in Miami, you know. Let's look at our patient population. Let's look at look at our background. Look at our diversity in our community.
mm,
It's we have to get outside of medicine. Is not just in the books. Like, now it's time to apply it to the community. So I it helped me see how sickle cell again has benefited me, is that it taught me that everything cannot be taught in a classroom and a book. We need
yeah,
services like you with the podcast. We need to talk about it.
mm,
We need to be out in the community about the disease state, because healthcare practitioners are not being taught everything in the classroom, and they're
mm,
moving
mm.
to communities. They love Miami. We got the beaches. They're coming here, having a good time, not knowing how to treat the patient population. So
Wow, wow,
too much.
wow.
I can a lot. You got to cut me off. You got to cut me off. I can go on and
What?
on.
No, hey, you got all the time in the world with me. Listen, this is fine.
Pump the brakes. So I keep going and going and going.
Trust me, this is fine. Um, that was my last question for you. So is there anything that you want to tell the sickle cell community or get off your chest, or anything that you want to, promote, or that you're doing, or
So yeah, again, my name's Ashley, clinical pharmacist. You can follow me at Kiss Wellness on Instagram. Not keep it healthy and simple. KIHS.wellness. I think
okay.
that what I do on my platform is assist people with learning about how to incorporate vitamins and supplements into their lifestyle appropriately and healthily. A lot of times with vitamins and supplements, because they're over the counter or we heard somebody talk about it, we think it's good to use, right?
Right,
And it
right.
may not be beneficial for us, or it may interact with some of our pain medication, right? Or
Yeah.
interact with some of the medications that we're taking at home, high blood pressure medication, diabetes medications. You want to make sure that you're selecting the appropriate vitamins and supplements along with your prescription medication. So that's specifically the service that I provide.
Right.
People, my patient population are patients that are living with a chronic disease state and want to know more about vitamins and supplements specifically for them because it's overwhelming, right? You
Yeah.
go to Target, Walmart, you see a whole shelf and you're not sure which one to pick.
Yeah.
Um, so you look at it and you're like, is this okay from, one thing with we have a sickle cell patients, some patients are on blood thinners,
Hmm.
right?
Hmm.
Some patients are on blood thinners, and they should know that they shouldn't necessarily be taking vitamin K over the counter. That interacts with the blood thinning medication. But vitamin K is you're told that vitamin K is great for red blood cells, but it's not great for someone that is on an that's taking a blood thinner daily. So that's just an example of what I do.
Okay. Uh, okay, so I should not be taking the men's one a day then. I should go deeper into.
Spends one a day. Multivitamin, I would love for you to start with a multivitamin. I would
Okay.
also, because you live in North Carolina, and it's about to, your weather, you don't always have like the amount of sunshine that we have here in South Florida. I want you to start taking a higher dose of vitamin D,
Yeah.
of vitamin D daily. But I want you to take vitamin D by itself.
Okay. I'm I, I'm about to give me a pen pad and all that. So after this, I want to talk to you and you help me because my doctor been wanting me to get on some vitamins forever, and I just never do it. So
Yes,
please,
vitamin. You need it's flu season. I want you taking zinc to boost
yeah,
up your
zinc.
immune system, zinc,
Yeah.
vitamin D. Okay.
Okay.
Keep continue taking your multivitamin. But those are the two other vitamins that I would add for you.
Okay. Okay. So one more thing. Do you recommend the flu shot or?
For people that are living with sickle cell disease, yes. And again, because remember, your immune system needs that boost. Making sure that you're up to date on your flu shot, making sure that your immune system is as prepared as possible to be able to combat everything that's happening out in the community. It's very, very important that we make sure that we're getting our vaccinations and that we're appropriately immunized because it's a
Yeah.
holiday. You're gonna want to go out with your friends. You're gonna want to go out to a party, and people coughing and spluttering around you is something that you want to make sure that your defense mechanisms are as optimal as they can be. I got my
Right.
flu shot. You should too.
Okay. Yeah. Yeah. I'm in school. I came back to school and that's something that they require. So yeah, I didn't know if I should do it or not. So
And then again, like making sure that you take your few day after you get your flu shot, taking it on like a Friday so you have the Saturday and Sunday to relax,
yeah.
before Monday comes up, before you need to start your day, or if you have like a few days off, just
Hmm.
taking time to be gentle with your body. Um,
Yeah.
yeah.
Yeah. Because every time I get a shot going to a crisis, I have no clue why. Like every single time.
Remember, you're
Huh?
getting a piece of the virus. You're getting a little bit of the virus, so your body is going to be like, "Oh my God, what is that?" And go into panic mode and put you into crisis. You know,
You're
it's
so
it's
smart. I did not know that. Oh my gosh. Okay.
the flu shot is a little bit of the flu. So the body that's the point of vaccination is to introduce the body to a little bit so that if you see it again, if the body gets exposed to it again, it knows how to fully react. So,
Gotcha.
maybe can you tell us more about like so you feel that every time you get the flu shot, your body goes into crisis. You've experienced
Yes.
wow.
Yeah, I'm in school and I'm in school for a phlebotomy and we had to get like a Hep B and all type of things. I got my Hep B and I went to a crisis for a week. So
Wow.
now when our flu they want us to get our flu shot and I'm like, I don't know. I don't want to go back into a crisis, but I don't
Um,
know.
Have you seen if you might be allergic? They have the egg-free vaccine. Like, what I would say is like speaking, do you have a hematologist?
Yes, I do. But I mostly go to the pain clinic, the Carolinas Pain Institute, and my hematologist, they want me to take it, but like it's different when you are going through the crisis, like everybody be like, just take it and you'll feel better in 2, 3 days, but in 2, 3 days will be
a week.
rough, right? Like, so I don't
Yeah.
know. I just, yeah.
I think that you brought up, and I think that one of the things that we should look at is if there is a type of vaccine, like the one that you've been getting, like is it egg free? Is it also like the preservatives that are in that specific vaccine? So there's some things that we can look at. That's why I want you to talk with your hematologist about
Mm,
what I would ask your hematologist, like with sickle cell patients, have you seen less of a reaction of crisis with a specific vaccine? Or is it
mhm.
just, so those are some things to think about and some things
Okay.
to, and that you've given me also something that I want to look more into and, and,
Yeah.
uh, and speak with hematologists that I work with. I have an opportunity to speak with hematologists. So, if you want to, invite me back on the show, we can talk more about vaccines and we can talk about reactions and crisis. And I
Mhm.
would love you to come back on and we could talk about that.
Let's do it. We have to. I'm gonna get
Yeah,
my flu shot probably next 3 days, and then I'm gonna tell you how it went, and then we're gonna hop back on.
we're gonna hop back on. Yeah,
Yeah.
because we
Okay,
can
cool.
get
Um,
studies and talk about it.
yes, please. Okay. So you say egg free?
Yeah, so you have some that are like egg free for people that sometimes have an egg allergy. You have the flu vaccine, sometimes some variants. Um, you have a stronger dose for patients that are 65 years and over. So you have
Mm.
different types of flu vaccines that are available to the community. And what I would love to do and take some time to do some research is to find out for patients that are living with chronic disease states, just as such as sickle cell disease, is there any research to show that a certain vaccine will work a little bit better? I don't know, but that's something that I definitely want to get speak with a hematologist about, do my own research, speak with I'm going to go to, like I said, my hospital. We have a sickle cell center. Get in contact with those physicians, and maybe we can. Hopefully, I hope that we're able to sit down and talk about it on your show, and I'll speak about them personally and share the information with you.
Okay. Okay. So we have something to do. You got something to do, and I got something to do. We're gonna get it done.
Yeah.
All right. Thank you so much. And I'm gonna post if you want me to. I'm gonna post your Instagram and everything at the end if that's okay.
Yeah, that's great. Again, Kiss Wellness, keep it healthy and simple. We don't Healthcare doesn't have to be complicated, and we have to learn how to take care of ourselves and
Yeah.
advocate for our health. Yeah.
Yes. And take the right vitamins.
Take the right vitamins are essential.
Yes. Okay, cool. Thank you so much
Thank
for
you.
coming out. Thank you so much.
Appreciate it.
Of course.